Has someone you love, maybe a parent or grandparent, started showing small, subtle changes over the past year? Maybe they're eating less, sleeping more, or just seem different. It's easy to brush these things off as just getting older. Most of us think that when death comes in old age, it happens suddenly, like flipping a switch. But the truth is, the body often whispers long before it shouts. It begins sending quiet, almost invisible signals, sometimes months or even a full year in advance. The problem is, we miss those signs. Not because we don't care, but because they're so easy to overlook. And by the time we realize what's really happening, the window to prepare, to say what matters most, to make those final memories, may have closed. In this video, we'll walk through 5 powerful signs that may indicate an elderly loved one is in their final year. Recognizing them early could help you bring more peace, more comfort, and more meaning to the time you have left together. Please, watch until the end. Number 1. Significant weight loss. One of the earliest and most noticeable signs that an elderly loved one may be entering the final year of life is unintentional weight loss. It often starts subtly, maybe a pair of pants fits more loosely, or a belt suddenly needs tightening. You might notice they're leaving more food on their plate or skipping meals altogether. At first glance, these changes don't seem alarming. After all, it's easy to chalk them up to normal aging or just a change in appetite. But when someone begins to lose weight without trying, especially in later years, it's important to take a closer look. This isn't just about a shrinking waistline. It's often the body's quiet way of signaling that something deeper is going on. As we age, the body naturally becomes less efficient, but in the final stages of life, this slowdown accelerates. Nutrient absorption may become impaired, even if the person is still eating reasonably well. The digestive system might not break down food as effectively. Protein, which is essential for maintaining muscle mass, may no longer be processed efficiently, leading to visible muscle loss. Over time, this results in a noticeable decline in physical strength. You may see your loved one becoming weaker, having more difficulty moving around, or appearing frail. These aren't just signs of aging, they're often signs of the body preparing for a larger transition. This kind of weight loss has a cascading effect on health. When muscle mass decreases, balance and mobility suffer, and the risk of falling rises sharply. A single fall can lead to fractures, hospitalization, and further decline. But beyond mobility, unintentional weight loss also weakens the immune system. The body becomes more vulnerable to infections, illnesses linger longer, and recovery times stretch out. In many cases, weight loss is a red flag that the body is no longer functioning at full capacity and is struggling to maintain the energy needed to support even basic functions. There are many possible reasons behind this change. Chronic illnesses, such as cancer, congestive heart failure, or advanced kidney disease, can all trigger gradual weight loss, even before other symptoms become obvious. Often, families don't even realize a disease is present until much later. In other cases, emotional and mental health play a role. Depression and cognitive decline, such as dementia or Alzheimer's, can also lead to a reduced interest in food. A loved one may forget to eat or lose interest in meals that once brought joy. Food might no longer taste the same, and the effort of preparing or chewing meals can become overwhelming. Understandably, many families respond by trying to help their loved one eat more, preparing their favorite dishes, offering high-calorie snacks, or supplementing meals with nutritional shakes. And while that comes from a place of love and care, it's important to recognize that sometimes, more food isn't the solution. When the body is in a state of decline, it may no longer respond to increased calories. Appetite naturally fades, and pushing large meals can actually cause discomfort or nausea. So, what can you do? Instead of focusing on getting them to eat more, shift your attention to comfort and ease. Offer small, frequent meals that are easy to chew and digest. Make hydration a priority. Dehydration is common in later stages and can worsen fatigue and confusion. Pay attention to how your loved one feels after meals, and don't pressure them. This stage is not about nutrition in the traditional sense, it's about preserving quality of life. Providing soft, familiar foods they enjoy, sitting with them during meals, and creating a relaxed atmosphere can help maintain dignity and comfort, even if they're eating very little. Recognizing and responding with compassion, not panic, makes all the difference. Number 2, extreme fatigue and weakness. Another key sign that an elderly person may be in the final year of their life is a deep, persistent fatigue that goes far beyond simple tiredness. This isn't just needing an afternoon nap or feeling a bit worn out after a long day. It's the kind of exhaustion that makes even the smallest tasks feel overwhelming. You might notice your loved one struggling to get out of bed in the morning, needing help just to walk across the room, or becoming too tired to finish a sentence during a conversation. They may start sleeping more during the day, taking longer and more frequent naps, and still seem tired even after a full night's rest. You might also notice them zoning out more often or having trouble staying alert during family visits or phone calls. What's going on inside the body is just as significant. As the body enters its final stages, organ function naturally slows. The heart may not pump as efficiently, which means less oxygen and fewer nutrients are reaching the muscles and brain. Circulation becomes sluggish. Metabolism, which normally turns food into energy for daily activity, shifts its priority. Instead of fueling movement or conversation, the body begins to conserve energy to keep essential systems functioning, like breathing and maintaining internal temperature. It's as if the body starts rationing energy for only the most basic tasks. This internal slowdown explains why your loved one may suddenly seem too weak to do things they managed just a few weeks ago. But fatigue isn't just physical, it takes a heavy emotional toll, too. For seniors who were once active, independent, and proud of their self-sufficiency, losing that ability can be deeply frustrating or even embarrassing. They might stop joining family meals, avoid answering phone calls, or withdraw from conversations, not because they've lost interest, but because they simply don't have the energy. Something as small as talking or listening for more than a few minutes may leave them feeling drained. Over time, this fatigue can lead to emotional isolation, which unfortunately only accelerates their decline. The less they interact, the more disconnected they feel, and this can spiral into a loss of will to stay engaged with life. As family members and caregivers, it's incredibly difficult to witness this. We naturally want to help, encouraging them to get up, take a walk, or eat a bit more. It comes from a place of love. But in this phase of life, pushing them to be more active can backfire. What they need most right now isn't motivation, it's understanding. Instead of urging them to try harder, the most compassionate response is to meet them where they are. Allow them to rest as much as they need. Offer a peaceful, quiet space without overwhelming noise or expectations. Sit with them in silence, hold their hand, or just be present. Sometimes, simply knowing you're there is more comforting than any amount of activity or conversation. Supporting someone through this kind of fatigue is not about helping them do more, it's about helping them feel safe and at ease doing less. Let them set the pace. Listen without judgment. If they can manage a short chat or a smile, celebrate that moment. If not, don't take it personally. Extreme fatigue is not laziness, and it's not a sign they've given up, it's the body's way of preparing for a major transition. Recognizing this allows you to give them the most important gift of all, comfort, peace, and the reassurance that they are loved, just as they are, in every moment you have left together. Number 3, cognitive confusion or emotional withdrawal. One of the most emotionally challenging signs that an elderly person may be nearing the final year of life is the gradual onset of cognitive confusion and emotional withdrawal. You might begin to notice subtle changes in how your loved one thinks, speaks, and interacts. Perhaps they start repeating themselves more often, asking the same question multiple times without realizing it. They might forget familiar names, misplace common objects, or seem confused in places they've known for years. These changes can feel sudden, especially if the person never had a history of memory problems. But in many cases, this slow mental shift begins months before physical decline becomes more obvious. What's happening inside the body can help make sense of this. Just like the heart and lungs, the brain depends on a constant supply of oxygen and nutrients to function. As circulation slows and the heart works less efficiently, the brain starts receiving less of what it needs. This lack of nourishment leads to cognitive decline. Essentially, the brain, like every other organ in the body, begins preparing to shut down. The result is confusion, forgetfulness, difficulty concentrating, and sometimes, moments of complete disorientation. As these changes progress, you may notice behavioral shifts. A once chatty parent may now sit quietly, barely engaging in conversation. Someone who used to enjoy family dinners might prefer to sit alone in silence or seem overwhelmed by too much noise or activity. Social withdrawal becomes more common, not because they no longer care, but because their brain simply can't process social interactions in the same way. Everyday conversations can feel mentally exhausting. Alongside the silence, you may also observe mood swings, irritability, sadness, anxiety, or even a calm, detached demeanor. Some individuals appear emotionally distant, like they're pulling back from the world around them. This is a natural part of the body and mind preparing for transition. What makes this stage particularly difficult is its unpredictability. Moments of lucidity may still come and go. One day your loved one might be clear, cheerful, and, like their old self, remembering names or telling stories. Then suddenly, confusion returns. They might not recognize people they've known their whole lives or forget where they are. This back and forth can be emotionally taxing for family members, who may feel like they're losing someone they love bit by bit. Supporting a loved one through this stage requires patience, sensitivity, and a deep sense of empathy. The key is to avoid forcing anything. Don't try to pull them into long conversations or correct every mistake they make. Instead, focus on being present. Speak gently and clearly. Keep their environment calm and familiar. Photos, favorite music, or familiar scents can provide comfort and a sense of grounding. Your presence alone, even in silence, can be a powerful source of peace. Many people assume that if a loved one doesn't respond, they can't feel love or connection, but that's not true. Even if their words fade, your love still reaches them. Ultimately, this stage is not just about what they can or can't remember. It's about offering dignity, compassion, and emotional safety. Recognize that their mind is slowing down as a part of the natural end-of-life process. The best support you can give is not through talking or doing, but simply through being there. A gentle hand on theirs, a familiar voice, a soft presence, these small acts speak volumes. As painful as it is to see a loved one slowly retreat inward, this is also a sacred time to honor who they are, reflect on shared memories, and remind them that they are still deeply valued and unconditionally loved. Number 4, frequent infections and slow healing. Another important sign that an elderly loved one may be in the final stage of life is the increasing frequency of infections and the body's growing inability to heal from even minor illnesses or wounds. You may start to notice they're getting sick more often, catching colds that linger, developing frequent urinary tract infections, UTIs, or showing signs of respiratory illnesses like pneumonia. In some cases, skin infections may appear, or you may observe sores and bruises that just don't seem to heal. Even a small scratch can become a lingering wound. These changes may not seem serious at first, but over time, they can be a powerful indicator that the immune system is no longer functioning as it once did. So, what's happening inside the body? As we age, and especially in the final stages of life, the immune system naturally becomes weaker. It simply can't mount a strong defense against infections like it used to. At the same time, circulation slows down. With less blood flow, the body's tissues don't get the oxygen and nutrients they need to heal efficiently. This is why infections become more common, and recovery takes much longer than it once did. Even medications that once worked quickly, like antibiotics, may seem less effective. You might find your loved one needing stronger drugs, longer treatment cycles, or more frequent trips to the doctor, only to find the same issue recurring again and again. What makes these infections particularly difficult to catch is that the signs can be subtle. Unlike younger people, the elderly don't always show classic symptoms like fever or obvious pain. Instead, infections may show up as increased fatigue, confusion, or a sudden drop in appetite. A UTI, for example, might not cause discomfort or frequent urination, but instead may lead to disorientation or sudden mood changes. Families sometimes mistake these signs for just aging, not realizing that an underlying infection could be quietly wearing the body down. That's why it's so important to stay alert to small changes, especially when they happen quickly or in clusters. Eventually, when these infections start to happen more frequently, and healing becomes harder and harder, it's a sign that the body is transitioning. At this stage, aggressive medical treatments may become less helpful and more exhausting. Multiple hospital visits, rounds of antibiotics, or invasive procedures may offer little benefit and cause additional discomfort. This is the point when many families and caregivers begin to shift their focus from curing to comforting. Instead of trying to fight every infection with more medications, it can be more helpful to focus on quality of life. Gentle, consistent care can go a long way. Prioritize simple but essential things like keeping the skin clean and moisturized to prevent breakdowns, ensuring they stay well hydrated, and making sure the environment is calm and low stress. Soft bedding, frequent repositioning, and careful monitoring of wounds or sores can all help maintain comfort. These seemingly small acts of care can make a huge difference in how your loved one feels in their final weeks or months. It's never easy to shift your mindset from trying to fix things to simply being present, but in this stage of life, presence and peace are often the greatest gifts you can offer. When healing becomes too difficult and infections too frequent, the body is telling us it's time to let go of the fight. What matters most now is dignity, warmth, and love. Recognizing these signs for what they are allows you to prepare, not just practically, but emotionally. It allows you to spend this time focusing on connection, reflection, and support, because even when we can't heal the body, we can still nourish the heart. Number 5. Major changes in breathing and circulation. One of the most noticeable and often most concerning signs that an elderly person may be nearing the end of life is a significant change in breathing and circulation. Families often find these symptoms alarming, especially because they can appear suddenly or seem to worsen quickly. You may notice your loved one's breathing has become irregular, sometimes shallow, sometimes with long pauses between breaths. This can include a specific pattern known as Cheyne-Stokes respiration, where breathing alternates between deep, rapid breaths and periods of no breathing at all. It's often unsettling to witness, especially if you're unfamiliar with what it means, but this pattern is a very common part of the natural dying process. Shortness of breath may also become more frequent, even with the smallest amount of movement. Simply sitting up, turning in bed, or speaking can leave them feeling winded. You might notice that they begin to breathe more through their mouth or have trouble catching their breath after a short conversation. In some cases, fluid may begin to build up in the lungs, which can cause coughing, gurgling sounds, or a feeling of tightness in the chest. These symptoms are often mistaken for a cold or chest infection, but in elderly individuals nearing the end of life, they typically indicate declining lung function. Circulation also begins to change during this time. As the heart grows weaker, it naturally starts to prioritize vital organs, sending less blood to the hands, feet, and skin. This results in extremities that feel cold to the touch, and skin that appears pale, bluish, or mottled, especially around the fingers, toes, and sometimes even the lips or nose. These changes aren't just cosmetic, they're clear signals that blood flow is slowing down and that the body is gradually shutting down. Understandably, these changes can feel frightening. Watching a loved one breathe in a labored or irregular way can trigger anxiety and a sense of urgency. But it's important to recognize that these signs are not always medical emergencies. In many cases, they're the body's natural way of slowing down, conserving energy, and preparing for its final transition. This is not something to panic over, but rather a moment to shift your focus toward providing calm, reassuring care. There are a number of ways you can help your loved one feel more comfortable during this stage. Start by adjusting their position. Many people find it easier to breathe when their upper body is slightly elevated, either by using extra pillows or sitting in a recliner. A cool, quiet room with good airflow can also help reduce the feeling of breathlessness. A humidifier can soothe dry airways, while small sips of water can relieve dry mouth. In some cases, low-flow oxygen or certain medications may be offered to ease discomfort, though not everyone will need or benefit from these. But perhaps the most powerful form of support during this time is emotional comfort. Speak gently. Offer reassurance. Let them know you're there, not to fix what's happening, but to walk beside them through it. This stage is less about doing, and more about simply being present. Your calm energy, your soft words, and even your silent presence can bring tremendous peace. It's in these final days and weeks that dignity, safety, and love matter more than anything else. Remember, breathing changes and poor circulation are not a failure, they're a signal that the body is naturally coming to rest. By understanding and recognizing these signs, you can respond not with fear, but with tenderness. And in doing so, you can help ensure your loved one's final chapter is filled with grace, compassion, and deep human connection. As we come to the end of this video, remember, these signs are not meant to create fear. They are quiet signals from the body, letting us know it's time to shift our focus from doing more to simply being present. Recognizing these changes isn't about giving up. It's about preparing, emotionally, practically, and spiritually, to make the most of the time we have left with those we love. It's about creating moments of peace, offering comfort, and holding space for love to shine through even as the body begins to slow down. If you're noticing these signs in someone close to you, please know you are not alone. Many families have walked this path, and though it's never easy, understanding what to expect can give you strength and peace in the face of uncertainty. We hope this video has given you helpful insight. If it has, please take a moment to leave a comment below, share what you learned or how you're supporting someone you love. Like, subscribe, and share this video to help others who may be on a similar journey. Your support helps us continue creating thoughtful content to guide and uplift families during life's most tender moments.